Hello, this is Varsha Singh for Healthline on TV Asia Telugu channel. Welcome, my viewers. This is our series on integrative, holistic, alternative, complementary medicine, where I bring you the another perspective of medicine, the other option of medicine that can help you heal yourself with the help of a very special expert that can guide you in the journey of healing. The reason I call it journey of healing is because that there is so much out there other than just a modern medicine. And there are many conditions where we may think that there is no option out there, but indeed, in fact, there are options out there which you can use to improve the quality of your life. We know that as human beings, we can function at our best level if our mind, body, and spirit is in balance. When I bring a practitioner to this show, it's my effort to help you, guide you, and give you a perspective that this practitioner has helped many patients with many different conditions. And if this interview helps you to have a different insight to take care of your own health, then my effort is successful. This is all I have to offer through Healthline. I want to bring you variety of speakers, different practitioners from all over the world so that you can gain more awareness into this mysterious world of medicine. There is modern medicine which is based on the evidence-based science, and yes, we must follow the advice of our primary physician, primary doctor, who knows you from many, many years and who is aware of your condition. But then there are this complementary and alternative medicine which can help you as well. So today, I bring you someone who is a successful homeopath in India, in city of Bangalore. I used to call it Bangalore. Now it is Bangalore. So let's meet our practitioner who is a successful homeopath from India, Dr. Latha Devarajan. Dr. Latha Devarajan practices in Bangalore and she has an experience of 30 years of practicing homeopathy. Academically, she is also training and she is coordinator of various academic activities in MLD MHI Bangalore. She is also involved in research, such as working as a research fellow in extramural research project for scope of homeopathy for children and learning difficulties in government school children under the MLD MHI Bombay. She has completed a pilot study in homeopathic management of slow learners in Bangalore. She is also a resource person for Ayush. We have heard of Ayush lately a lot during the pandemic. So she is a resource person. They are reaching out to Dr. Latha Devarajan for her expertise, especially for mother and children. As a publication is concerned, she has published articles and presented papers on dysrhythmia, that is actually the women's disorders. She has presented on PCOD, hypothyroid, anxiety disorders, dyslexia, and many more in NJH, and she is an editor in New NJH as well. She has presence nationally as well as internationally. She has presented at seminar and she has co-authored a research paper in an Asian Journal of Homeopathy. As a soft skill, as Dr. Devarajan very mightily puts, she is an integrative health practitioner and a coordinator for yoga and learning classical music, instrumental veena, and building teams. And you can see that this is such a holistic profile of a practitioner, and it's my great pleasure to invite Dr. Latha Devarajan to Healthline on TV Asia Telugu channel. Welcome, Dr. Devarajan. Welcome to this show, and I'm looking forward to have a wonderful conversation with you. So, Dr. Latha Devarajan, I would like to start off this conversation asking you the first basic question first, that is, tell us about yourself and tell us about your practice.
So I'm a board certified homeopathic practitioner and a graduate of the very prestigious Homeopathic Medical College, CMPH, Bombay. I have my practice primarily in Bangalore, but due to the modern technology, we have been able to access patients all over the world, practicing since 28 years now. And let me see how, I share with you how I gather my information for every patient, as you can see in slide one,
Thank you so much,
please.
Dr. Devarajan, Latha, as I call you. So I see that in your slide you have listed the factors such as predisposing and precipitating. What does it mean?
So, Varsha, the predisposing factors are those that which we are born with, and it is our genetic inheritance. All of us have a DNA that carries risk factors and familial traits. Then there are precipitating factors, which can be, like the weather, injury, but bacteria or virus. But very important are the emotional, intellectual, and behavioral stresses that all of us have within us. And this will impact our mind and body.
Thank you for explaining that. And I just also see that on this slide you have mentioned disposition. Now, what does it mean? And when you are saying disposition, do every individual have a different disposition? If you can just elaborate on that part.
Yes. So our disposition is an innate response to any stimulus. The stimulus can be external or internal. Every person has a different disposition and not the same. In simple words, every person responds to stressors or stimulus differently. When a response gets generated to a stress, the outcome can be different for every individual. Some individuals come down with a very simple indisposition, and some come down with a disease, which we call ill at ease. I would also like here to share that these stimulus that I've been talking to you, Varsha, about this disposition can be environmental, dietary, which are the main conditions. But in homeopathy, we address everything. And these factors that can be environmental, dietary, or internal or external stimulus are the maintaining factors for a disease. And they are so important for us as homeopaths. And it is so important also that we consider the entire picture before we start the treatment.
So, when you are talking about multi-dimensional approach, can you explain what else do you use in your treatment?
So, what I shared earlier was a multifactorial approach, but the multi-dimension means I also incorporate yoga, counseling, nutrition, and educating the patient why he's suffering. And I found that very beneficial in my practice.
Thank you for sharing that. It really makes sense. So, when we are talking about treating variety of conditions, there are so many conditions out there, and the patients have so many diseases. Can you define the scope of homeopathy?
I would like to use a realistic approach and a scientific approach, which allows us to use investigations and diagnosis and pathology to aid our homeopathic management skills. So, what is important is all structural, functional, reversible pathologies are curable by homeopathy. So, if there's no severe structural damage to the organ, then we feel that it is definitely treatable by us. But if there are advancing pathologies which cannot be cured, then we can only palliate and provide symptomatic relief.
Very, very beautifully explained. So, question is, we have so many conditions in that is kind of defined as incurable. You know, they talk about that this is incurable, nothing can be done about this. So how does a homeopathy offer better outcomes for so-called incurable conditions?
So I would like to say, Vaisha, that there is a scope for many diseases that are labeled in inverted comma as incurable, and those conditions can be managed. For example, 70% of our diseases WHO lists under psychosomatic conditions. But diseases like asthma, skin disorders, eczema, psoriasis, irritable bowel syndrome, ulcerative colitis, chronic hypersensitive responses, allergies in any age groups, primary hypothyroidisms, arthritis, or any psychoneuroendocrine disorders. So basically, for all these chronic conditions, patients are required to be on long-term medications, sometimes for life. However, as I shared earlier, if any of these pathologies are functional or structural, but in the reversible zones, I would say homeopathy has a very good scope of ensuring that we do not keep patients on lifelong medications. So, in that sense, the inverted commas incurable diseases actually can be curable.
And I see that the reflection of your 30 years of experience and the confidence with which you are saying that, yes, there is an answer to this incurable disease. It is generating a lot of positivity in all our viewers who are watching this interview right now. It really brings me to our main title of this discussion. And, one of these I want to share your expertise about one particular disease that is termed as, the incurable, which is actually the cause of a lot of anxiety and kind of fear when a person is diagnosed with psoriasis, which is actually, if you look at this disease, they are always looking for answers. How do I get rid of it? So, can you please share your expertise on psoriasis? So, what is psoriasis?
So, Varsha, let's start by telling you that any skin condition generates a lot of fear and anxiety because you know and everybody knows it's so important to have a good looking skin so that we get acceptance by people. And psoriasis is one of the most difficult and painful conditions because it's an autoimmune disease that affects the skin. And let me explain that by the slide what you see. The skin usually has a maturation cycle of 3 to 4 weeks. But in psoriasis, our cells immature and advance very rapidly without going through that entire process, and you find that it comes on your surface as scaling with lot of itching. And because there is an autoimmune response, there is also a lot of inflammation and redness. Again, there are different types of psoriasis, and each psoriasis comes with a different presentation. However, the basic pathology is autoimmune with fast maturing cells that come out as immature scales on your surface. And this really makes a difference to you because the appearance of a psoriasis skin can put anybody at unease,
Yeah.
both for the person who's suffering as well as the people around him.
Yeah, you said it because I was just going to ask you, like, it's not just the patient, it is the family around and the relatives, and also if it is a small child, then it is also the parents who are equally impacted. So there is a lot of involvement of surrounding factors that impacts this condition. So, Dr. Latha, I understand that there is physical as well as a great psychological or psychosomatic impact of this condition on any patient. I'm sure you have both kind of patients, some who have been to the dermatologist and gone through that 9 years of modern medicine and then come to you, and then there are some patients who have opted, oh, I'm going to go to a homeopath first. So I'm sure you have both kind of this patient. Now here my question is, what is it something different that you offer from a typical dermatology office, which will provide a standard treatment for the psoriasis patient? So if you can just share that with us.
Very good question, Varsha. It's so important that we see both kinds of patients. Some who have tried everything and come to us, and some who come to us as a first choice. As you shared, Varsha, the typical modern approach is just ointments, topical applications, and sometimes they give oral medications like steroids and anti inflammatory pills. But for psoriasis, when we as a homeopath take it as an approach to a case, we basically want to heal the conflict within and heal the skin and let your skin shine and reflect this resolution that we are offering you as a homeopath. So I think that's a really big contrasting difference.
Yes, and I know right now I'm kind of repeating myself, but why do you have to ask so many questions which has nothing to do with skin? Someone comes like, just make my skin look beautiful. I want this psoriasis to go away. I want this skin to look just like how I was born with it when I was a baby. So why, again, so many questions? And some patients may ask, why are you asking me about how was my childhood? I am here for my psoriasis and treat it. So just share why you approach, multifactorial. And that is something that I really want our viewers to understand.
So that 5-box slide that is coming up, Varsha, to understand, what are those causations that we are looking at. Earlier, we have already spoken about the genetic and the predisposing and the maintaining factors. The 4th box was very, very important. Who are the personalities who get psoriasis? These are very sensitive individuals. And as you see, that's how they're born with, and they grow over a period of time with lot of emotions that are suppressed, and they're not communicating outside the suppressions that they are carrying with them. Our skin is one of the largest sense organs that allows us to connect to the world outside. It's probably the only organ that picks up instantly our innate sensitivity to the world outside. What is important for us as homeopath is to draw the portrait of this patient behind that extremely sensitive patient that we are having in front of us, who is suppressing. Why did he become like this? Is it his own innate sensitivity that he's born with, or has it been added by various stresses in his childhood? And are there any causes in the last 2-3 years, what we call the emotional, intellectual, or behavioral traumas, that have added to this particular illness? I would also go back to say, along with the other predisposing, disposing, and genetic factors. Only when we put these 4 boxes together, we will find the right remedy that fits like a glove to this patient. Once the internal healing begins with the medicines, the skin will shine back and pave you a path to live in this beautiful world. And homeopathic medicines with counseling, yoga, nutritional changes, and many other factors can guide you to help this patient be a part of the world which he has held back for so long.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన, సంతృప్తికరమైన లావాదేవీలను చేసిపెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 9083049621 or 9083371289.
Thank you for sharing. It really makes sense and proves that, again, going back to the homeopathic principle, that your physical symptoms are a reflection of the turmoil of your mind. So at this point, I'm sure you have some of your success stories that you would like to share with our viewers.
So, Varsha, what I find is, not every patient is willing to open up and, share with us or ventilate. But when we find that patients are willing to open up, ventilate their stresses, their traumas, and their conflicts and their sensitivity, we find that, the internal healing is very magical. And with both our remedial and non remedial measures, the results can be really long lasting, and more what we term as curable. So I would like to say, as a homeopath, we really can heal them without any remissions in, say, maybe few months to a year, and heal them for life. So I would like to share a case study to give you an insight of this particular approach.
Okay, so can we go over the case number 1? If you can say a few words about this case that you treated.
How much intensity of that plague psoriasis must have bothered this patient, because it was all over his extremities over the last 4 years, and he's been on topical applications, internal medications, but they come, it becomes a little bit better, and again it flares up much more than what it was earlier. And that picture can tell you the intensity of this suffering. So what happened was, we tried to go back to our multifactorial causes. There was a genetic predisposition. His mother is also having psoriasis. She is also a very sensitive lady. And then we have a very strict father who has been extremely controlling. And this sensitive child has learned to suppress his anger and not talk back. And his only response is he will keep it within and tremble with fear and anger. This continued for a very long time. And when the child grew up, he wanted to make relationships. When he reached the age of marriage, he tried getting into few relationships, but they did not reciprocate back, as a result of which he felt even more hurt. Finally, he got married to, it was an arranged marriage, and this particular wife did not meet up to his expectations. And she would also, react quite angrily, like his father would do. And he was not prepared for that kind of a personality in his life. That is when, since 4 years, due to the chronic state of suppressed anger and hurt, he started getting psoriasis, which was never there before. So there's a genetic predisposition, there is a precipitating factor in terms of this marriage event, and there is an emotional trauma of suppressed anger. And then we found out the right remedy and gave it to him. And you can see the cure that happened over the next few months, that is in the next 3 to 6 months.
That's quite a story. And it really explains how you considered the precipitating factor, the predisposing factor, which was genetic, and then also the maintaining cause, which was kind of a continuum of having an anger that was suppressed. I think our viewers are able to understand the approach where you are actually taking in consideration not just the physical symptom, but what is behind, what is the story behind those physical symptoms. So we do have a video clip of one of the patients that Dr. Latha Devarajan has treated. So let's look at this video.
So here it is, it was a full area it was, and here, this, leaving this also, and the complete nail also was completely with patches. Now it is better. It's only the marks. It is not, no itching and no scales formation, nothing is there. It's only the mark. Yes. So this is the area where where it started first. in the beginning way, and then it got spreaded everywhere, and it's almost like a complete leg below my knee, and it was a complete scale formation. So, now it is completely, it is gone. It's only the mark is there and no itching also. So it is only the dryness. These areas are only the dryness. So only the marks.
So I see that the patient is narrating how he was feeling better, and we can actually see on his hand that his psoriasis has gone back and it has reduced a lot. Did you have anything specific about this case that you would like to say, Dr. Devarajan?
No, just that the constitutional, the chronic remedy that we chose, covering the different causations and counseling, because they both needed to identify their strengths and weaknesses as husband and wife and come to a point where they are able to balance themselves out in their sensitivities. So that allowed the healing to happen faster. And also the patient was put on certain kind of diets which were not going to aggravate his conditions. And he also was asked to, stay away from extremes of cold weather and protect his skin.
So there is just one more question. Both these patients, now this is a question which many people will ask, like, do we have to take homeopathy for a long time? And in one case, you said one patient came to you for 4 years. And in this second case, can you just throw a little bit light on the duration of treatment?
So this case, Varsha, it required only 6 months of treatment because he was willing to share his internal conflicts. He was willing to introspect, and then the stressing, the precipitating factors were put into place, and the medicine was given for 6 months, and the recovery was magical. And we find these kind of responses even with children who are very virgin in their susceptibility, and it's very easy to recover them. Some cases where we are not able to find all the causations, and sometimes they are not willing to travel with us through the entire period of ventilation, understanding why they are suffering, then it takes for us probably 2 to 3 years to manage that case. So I have given you a graph in my about how we have studied the different case studies over a perspective of 107 cases in a similar age group. We have found that younger the age group, faster the recovery. Patients who have not been on too many topical medications for many, many years, faster the recovery. It could be just 6 months to a year of treatment. Patients who are willing to look within, ventilate, and listen to our advices on counseling, yoga, diet, everything, they recover faster. So roughly we would say there are failures. So we would put them under the category of 65 to 70% of good results and 20 to 30% not so good results.
Yeah. And I just want to clarify, because we are in a global audience, when you say that if they are able to ventilate, and here when you are using the term ventilate, you are not using, this is not the ventilator. We are not talking about the ventilator. We are talking about that they should be able to express or share their emotions, ventilation of emotions. This is what we are referring to. So I just needed that one clarification.
Yes.
These are some really great stories. And I have one more question before we go to our next slide. Do you advise them to, once they are cured and once the 6 months or 1 year of treatment is over, do you usually advise them to continue with some kind of preventative? We say that you can take this so that it doesn't come back. Is there anything that you do, kind of a continuing management?
Exactly. Diseases like psoriasis require at least a 5-year follow-up to say before you have cured the case. So it does not mean in 6 months, if I have recovered, that you've cured the case. There is a chance of relapse and remission after some time. So I can never claim a cure unless I follow them over a period of time. So it is important for me to keep advising them that at least visit me once in 6 months. At least come and talk to me and tell me how you all are doing. And I would also give them stock medicines. Anytime you find a small lesion coming, even if you can't reach me, ensure you take the stock medicines. So it's really important. We do not allow this patient to just slip away after 6 months. He has to be with you for 5 years minimum. And he needs to follow up at least every 6 months to come and tell you that everything is fine.
Thank you, because this is something like the well visit. Just let me know that you are fine, right?
Yes.
And keeping an eye and having a great follow. So these were some really great success stories, and the way you explain the process of healing for patients with psoriasis. I'm sure that our viewers have gained some perspective here. And again, I always emphasize to all my viewers that what we are sharing is an individual experience by an individual practitioner. Every person is a different individual. And what you are sharing is solely your experience with your own homeopathic practice. And as a disclaimer, I always tell, because we are in presence of global audience, always consult your primary provider, because sometimes you have a modern medicine primary provider and they know your system. And in case if you are looking at the option of alternative or holistic therapy, make sure that you involve your primary physician and always consult so that you can make the right choice. And Dr. Latha, lastly, I would like to ask, there are some key pointers that you would like to advise our viewers, especially those who have never tried homeopathy before. So what would you like to share with them?
Varsha, the message that you shared is very, very important, because we always need to work with a team, and the team consists of an allopathic primary provider and us and the others. So if we do not take the confidence of the primary provider, that is the dermatologist, we will not be doing justice to the case. So that is one of the first key pointer, like you mentioned. The second key pointer, Varsha, as you're talking on this beautiful day where our founder was born, April 10th, and his words, his intent with which he started this system was so important for all of us who became homeopaths. And his blessings was very important for us to carry forward his legacy. So I would like to share one of the letters that he wrote to his nephew on choice of a physician, because that intent of that letter will tell you what you should keep in mind when you visit a physician. So in that letter, he has written that any physician, any homeopathic physician who is willing to listen to you, who is willing to be with you in this journey of a healing process, who is willing to share with you the conflicts that you're going through, the baggages that you're trying to share, who is willing to understand why you're suffering and make you also aware why you're suffering. That is the physician that you should approach. That will ensure that you get the right remedy and potency, what we term simillimum. And lastly, on this beautiful day, again, as I said, on April 10th, the birthday of Dr. Samuel Hahnemann is celebrated across the world by every homeopath as a tribute to homeopathy and the art and science that heals from within.
Very beautifully said, Dr. Latha Devarajan. It was really nice to have you on Healthline on TV Asia Telugu channel. Thank you for sharing your experience as a practitioner. Thank you for sharing all your success stories with our viewers who are listening to this, and they are getting a perspective about the science of homeopathy. At the same time, they are also getting a perspective that there is an answer if they are looking for an answer. And if they want to reach out to you, then we have some information about your practice, which will be displaying on the slide. And if they need to consult you, they can contact you at your office. I appreciate your time and that you spent with us and shared your experience. So thank you for everything.
Thank you so much, Varsha. You're doing such a wonderful service despite being so busy as a wonderful practitioner yourself. And yet you're taking the trouble to see that our system reaches to the masses. And remember, it's always a joint effort. There's nothing like this system is better or that is better. So you've been so kind and so sensitive and so sensible. Thank you so much for this opportunity. Deeply grateful.
Thank you. So, my dear viewers, I would like to say that if you watched this episode and if you liked it, maybe it has started some thinking process in your mind. My effort here again, as I always say, is to bring you different perspective of medicine, which can actually help us as an individual, give us a little bit more knowledge about what is out there. If you have any question or concern, I will definitely like to address it in our next episodes. Continue to watch Healthline on TV Asia Telugu channel. For now, I will say bye. Your host, Varsha Singh. Thank you.